Hello, I'm Annette Anderson, and I'm the Academic Programming Director for the Center for Safe and Healthy Schools. Today, we are excited to have with us Dr. Yolanda Abel. Dr. Abel is the Associate Professor in the School of Education, and she's also the Department Chair for the Advanced Studies in Education programs. We're here today to talk about the coronavirus in schools, and so I'd like to say welcome, Dr. Abel.
Thank you, Dr. Anderson.
Thank you for being here. We just want to start out by talking a little bit about the stress and anxiety that is starting to take place amongst teachers in our schools. Can you talk a little bit about why this might create additional anxiety for teachers and school staff in our schools as they start to think about options to deal with the coronavirus in their schools and just hearing about what's happening in other districts across the country?
Dr. Anderson, this is a multi-pronged issue in terms of stress and how a teacher might be looking at this in an area such as Baltimore City or any other urban area where children are part of a vulnerable population and might be going home to less than ideal circumstances in terms of food insecurity, heating, all types of issues when one is thinking about staying quote unquote healthy and in the context of this virus. Thus far, it seems to really be having an impact on individuals that have underlying health conditions or concerns and kind of have some vulnerability around that. So just the stress of wondering that for those students who we are aware of kind of have those circumstances, much less the ones we're not totally certain about, because lots go on in the lives of our children that sometimes we know, sometimes we don't until something else happens in that context. You also have the teacher who most likely has some family of his or her own in regards to wanting to make sure they stay healthy, the interactions that their children of school age might be having, or even adult age, because of how the virus thus far is hitting adults more than it is hitting children. So just kind of how do you stay healthy overall, both in terms of who you are as an individual, your classroom, and any other adults that you are interacting with.
Teaching is already a stressful profession, as you've indicated. How do you think that teachers are responding in real time to trying to deal with this and not knowing, you know, if something's going to happen in their school or in their district today or tomorrow with the rapid advance of how this is evolving in real time?
Teachers are resilient.
Yes, they are.
School systems are responsive to some degree. So if you've been online looking at different school districts throughout the state of Maryland, most of them have some statement about the coronavirus and kind of what they're doing, how they're keeping in touch with local health departments, and following the same general guidance from the CDC in terms of what we should be doing, washing our hands, soap and water, 20 seconds, making sure that you cover your mouth and nose if you sneeze, throw the tissue away, keep washing those hands, kind of the key. So we're reiterating that. I think schools are doing that as well. So are teachers. I know sometimes it can be a challenge around resources, if you will. I can remember when my child was in school and requesting donations for box of tissues, Clorox wipes, things of that nature. So I think teachers will do what they have always done and be resilient and networking in terms of who has what and can share and get the word out, because for whatever reason, what a teacher needs may not always necessarily come from students directly and or students' families for a variety of reasons, but they want what is best for their children, so they usually make sure that they can make that happen.
What should teachers do to minimize potential disruptions for students in the case that schools are closed or schedules are modified? What do you think that teachers should be thinking about as they're starting to prepare for this inevitability in some of these areas as the number of cases of coronavirus continues to grow?
Some of that will depend on if we're talking early childhood, elementary, or high school.
Okay.
So if I'm a high school teacher, most likely my students already have somewhat long-term assignments. So the encouragement of making sure books, materials are home with you if you need to stay home, either because of personal illness or some larger issue that might happen and impact how schools are open or not. There might be a little bit of overlap in middle school. Elementary, early childhood tend to be a little different. So just that encouragement around continuing to read, interact, kind of how you find that engaging, teachable moment in what you do, if you're cooking dinner, if you're watching the television show. The debate around homework packets has been interesting, so that's not necessarily going to be my piece of advice. It's really more so around reading and continuing to have that type of conversation around what's going on in the world, even with young kids, because that's one of the ways that we build their metacognition as well as their vocabulary, to just kind of that encouragement. If a child happens to be out of school, either because of personal illness or because schools have a larger issue and they decide to close down, At some point, schools will need to make some suggestion around kind of how that work gets made up, what gets transmitted home to families and things of that nature. But again, reading is fundamental. I'm dating myself age-wise, but I do believe it. So I think if you're just doing those kinds of things and continuing on with the conversation, that your child will be okay.
So there's a lot of discussion in the ether about using technology to substitute for face-to-face learning, and a lot of districts are currently considering whether or not they should go to just using online platforms in place of the traditional face-to-face instruction. Can you talk a little bit about how there are gaps with a strategy like that and what people also should be considering as they make those decisions for populations that tend to be more vulnerable and at risk in this conversation?
Some of it is the easy access and whether or not I have that in my home. Do I even have it in a library that might be accessible? Because, Baltimore City closed lots of neighborhood libraries several years ago at this point. So while that is an answer, it might not be the most viable answer in terms of someone really having easy access and availability. So again, I fall back on that reading, the conversation in regards to what's going on in the world, the thinking, the how, the questioning, and the rest of it will work out. If students a little older, middle and high school, again, slightly different place. We might be reading books digitally and things of that nature anyway. So it can be a part of the plan, but I don't think it should be the only part of the plan and the key onus, because as I told someone the other day, while it's March, we could snow still. Yes. And goodness forbid, some snows have been, more than others.
Every once in a
and
while.
Sometimes you lose power and other things. So that's still not the total answer, but it can be part of a strategy that's utilized to help keep students invested and involved in their educational studies.
What should schools be thinking about outside of the normal school day? So I think a lot of the focus has really been about how to supplant face-to-face instruction with some of these technology platforms. But we know that for students who are at risk, that there is a knitting together of a number of programs, the before-school breakfast, the after-school activities, the weekend extracurricular activities. What should schools also be thinking about as they go to trying to plan for, if schools close, some of this inevitability of a gap in terms of connection, physical connection?
Yes. Some schools are community resource schools. Almost all schools have someone who is connected and making that family community engagement aspect. So as part of this process, keeping in touch with those agencies as well. The nature of the virus, what we're experiencing right now, means some of those might be impacted too in terms of people get sick, overwhelmed. But if they're going to be offering special programming, opportunities for meals, things of that nature, to kind of just keep the network working. Robocalls in terms of sharing information as things get shared. If your teachers are utilizing Class Dojo, kind of whatever has been working for that day-to-day communication, to still utilize those same types of strategies just to kind of share different information around where people might get help if needed in terms of those types of things.
And then for parents, let's talk about from the parent perspective. If you're a parent who's trying to, patch all these things together to make sure that your child has a seamless academic experience, but you have to go to work. You don't have the luxury of being at home when school is closed. What should you be doing to try to think about supporting your child during this time of anxiety and inevitability?
First and foremost, letting your child know that you're there for him or her, that you care, that you are concerned, that you're, again, encouraging that hand washing rule, soap water, 20 seconds. In terms of who might be watching a child who's still of age that requires care, as opposed to those children who are legally old enough to stay home by themselves and or watch younger siblings, ideally there's some kind of support network. And if you don't have one yet, then to try and reach out to other people in your school, other parents in your building or your neighborhood where you live, so that you are identifying someone that you feel safe and confident that if you really need it, to talk, to leave your child at home because school was closed but you needed to go to work, you'd have that avenue. And then last but not least, depending on where you work, to have some conversation with your supervisor or boss in terms of kind of what are options and possibilities, because there's a lot of unknown right now in terms of what's going on, how things might happen. And as a parent, your primary focus is on keeping your child well and safe.
Absolutely. And it is unprecedented in that way, that we don't have
all the answers or even when they might come.
Exactly. So those are some good strategies. And what about community organizations? Do you think that parents should be trying to get in touch with community organizations early if they offer after-school programming or, Boys and Girls Clubs, Girl Scouts, those kinds of just after-school clubs that perhaps are, in the community? Should they be reaching out to those organizations to try to set up some sort of plan to be a patchwork as they try to figure this out? Or do you think that they should just work with the school alone to try to help to figure
Well, first and
figure
foremost,
this
if they're
out?
already involved in those types of activities, to keep the lines of communication open with the directors and persons who run those programming about when they'll be open, because for things that happen after school in schools, they might not happen because that's the physical location if a school is closed. Also taking into consideration in neighborhoods, communities, while lots of things are walkable, again, looking at the age of the child, they may not be, so is that a genuine effort and option? There's no harm in contacting an agency to asking if there's some exception, but most of those types of programming have some process of admissions requirement. It's usually not an instantaneous drop-in, if you will, but there's no harm in inquiring, again, who might. But again, I think the school is a good place for a resource about what's potentially going to do that and be that option that might not necessarily operate in those same ways under the normal circumstances of life.
Sure. Well, I'd like to thank you, Dr. Abel, for coming by today to talk to us about some of these challenges. And you've had some really good ideas, and I think it will be helpful for our families, it will be helpful for teachers, and helpful for our schools. So I'd just like to thank you.
Thank you, Dr. Anderson, for allowing me the opportunity.
Yes. And I'd like to thank you as our guest for joining in today for the Center for Safe and Healthy Schools and our discussion about the coronavirus and schools. Thank you. Take care.